Hello to everybody. I will now give you an introduction as an opening of a YouTube channel. So welcome to my speech. Today we'll be talking about the difference between the gaming for having fun and gaming as an addiction. I'll be talking about the distinction between the two of them. And this is a general topic that we most frequently discuss. But I think we have to start with the definitions of gaming for fun and gaming addiction, or the digital addiction, I would call it, not only the gaming. So I'll be touching upon the issue of distinction between the gaming for fun and gaming addiction. So we are talking about two different models. I will be talking about addiction as a process, about prefrontal cortex, and the clinical differences will be mentioned. The technology and the digital world is used as many purposes. These purposes will be explained. So recreational game users, so gaming for fun. It is not an addiction and it is a healthy use of games. As you know, when we take a look at the history of this issue, the first internet addiction case dates back to 1996. So far, there has been many research, and all of them compared the addiction group with the control group. But new research shows us that there is a comparison between game addiction and recreational game users. So in the municipality advertisement boards, they always say the recreational areas and recreational complexes and so on. And there is a department in universities, the recreational design. A 4-year long education is given in these departments. So recreational as a word is not something to fear. It is like spending your time as best as possible, as good as possible, in your leisure time, doing enjoyable activities, boosting your creativity, enrich yourself culturally, and make you feel better so that you can go to work or whatever obligatory tasks you're entitled to in your daily life without losing your enthusiasm. So recreational means that you have fun when you're not working. So recreational game users also mean that. So the people, the users who game, who play games as a leisure time activity. There is no definite definition, a clear definition of recreational game users, but still in the research, it is not very correct to call them the control group. Because in the research, the DB positive group with the diagnosis of game addiction, and the control group would be the ones who are not diagnosed with game addiction. But if it is about the game, there is no group for diagnosis. They can be separated into two. One group, the game addiction. The second group is just gamers for fun, recreational game users, as we call them. So, today we'll be talking about the dopaminergic system of our brain. I will not repeat them one by one, but the part that the addiction physiopathogenesis for us is important when mesencephalones, the dopamine producing part of our brain going towards the addiction, which is the most important mechanism for addiction. In our brain or in our mind, there is a structure. And the reason of this structure, according to our assumptions, is that for the continuity of the daily life, Sometimes we have to do the tasks and we do dopaminergic projection in order to provide continuity for these boring daily tasks. So workout and having sex or marriage or raising kids are the examples of the tasks that are quite challenging and needs sacrifice. In the vertical tegmental area towards nucleus, the dopaminergic projection gives us joy while doing these difficult and challenging tasks. The mothers know that, while raising a kid, your brain produces dopamine, or there is a dopaminal projection that gives us the satisfaction of raising a child, and these sleepless nights and sacrificing from your own social needs do not bother us very much because of that. And they do not regret, they do not resent the idea of having kid or even having a second kid after the first one. The reason of this lack of regret or resentment is that when you take when you come eye to eye, when you have an eye contact with your kid, you have joy. This dopaminergic projection excreted in your brain gives you that joy. This is about workout as well. You have to sacrifice and you have to physically tire yourself. You have to pay money to the halls and so on. But as you continue working out, you want it. You like it, and even though you are tired, even though it's expensive, you continue. So about the evolutionary psychiatry. The challenging tasks needs to be rewarded for the Homo sapiens to continue doing them. And your brain rewards us with the dopamine and our own morphine, actually, or our own drug. But when we stimulate that system too much, they can cause addiction. Technology addiction is one of these addictions. In the DB pathogenesis, dibiphasic dopamine excretion should be remembered in the lack of attention, in the attention disorders. Normally is caused by the distortion of the stomach dopamine levels, and phasic dopamine levels needs to be reduced in order to get rid of these abnormal levels. And this phasic excretion can be compensated if there is a distortion by drugs and by treatment. When there is a deviation in phasic excretion, dopamine peaks very high and then it is reduced very rapidly, and therefore you have the feeling of absenteeism. So the synaptic range is deviated and you kind of exclude yourself from your daily life and tasks, and you become an addict. Otherwise, the activities normally would give you joy. When we tackle with addiction, we have the reactions from the children. When you take a telephone from their hands, for example, they say that they are bored. They say that they do not, have joy from anything because the dopamine levels are deviated, and it takes time to go back to normal. Our model is very triadic model, something that we know very well. Prefrontal cortex, ventral tegmental area has a relationship. Vertical tegmental area in the striatum, the projection, let's call it striatum, is the cause of our instincts and our nudges. And amygdala is like a moderator between two. Prefrontal cortex sometimes show me the results of my long-lasting actions, so that I suppress this projection and I find the right path. But sometimes we cannot do that because this projection is much more oppressive, and we become unable to project the results, and we become enslaved to the feeling of excitement, and we become addicts. We can never stop doing this action that we are addicted to. It becomes a compulsive behavior. And in this system that we know as the classics, especially as a neurobiological structure represented by insula, interoceptive system exists as well. Interoceptive system, proprioceptive is something different, by the way. The silence network, this is what I am talking about. Silence is that, the attractiveness. Especially in addiction, there are tips, and for grasping the tips, there are high sensitivity. For example, a smoking addiction, in smoking addiction, the addict may quit smoking, but whenever they see an ashtray, they want to smoke again. So this is the silence network. It is the active neurobiological center behind craving. In a game addict child, they have craving because they see tips when they are conversating with their friends or something that they see in their daily lives, because the nucleus conversal is strengthened a bit and they associate the emotional elements in their addiction. This is the reason why we are tackling with the cravings and emotions. Another explanation, neurobiological explanation in addiction, for technology addiction specifically, is that this behavior has a compulsive characteristics. From impulsivity to compulsivity, there is a road. Impulsivity means that you cannot help doing something. So it's like having the first experience. You are treated with a cigarette by your friend, and it's an impulse. You just cannot say no, and you take one drag because there is no harm afterwards. You can stop anytime you think. The compulsive behavior is that you do it even though you know that it's harmful, but you cannot stop it. We can associate it to technology addiction as well. You open an Instagram page, for example, and you say to yourself that you will check it every night. So this is the impulsive behavior. But after a week or two, you open Instagram once in every 10 minutes because your behavior is now compulsive. It has a compulsive characteristics. So you keep an eye in your phone like every minute. You open each and every notification on your screen, etc. When I see a technology addicted kid, or when I'm talking to his or her parents, as a clinician, we have to understand the level of this behavior, whether it is more impulsive or compulsive. We have to see the level of the behavior in the range from impulsivity to compulsivity. Because if a behavior is becoming compulsive, then the person will start to encounter the negative results of this behavior. The functional connectivity, the Human Genome Project, this one is like that one. It has been completed, but there are some spin-off research. Connectome is a yarn of knots that are all interconnected, whether anatomically or functionally or effectively. The first brain scans were mainly more structural, like MRI or tomography, etc. And the images, or the neuroscience paradigm, was mainly about these anatomic connections. We can classify cortex within itself. We can know about the fascicles connecting different areas, vernicle and broca, and connected by auricular fascicle and so on. They all show us the anatomic connectivity in the former times. But about fMRI and the EEG studies, we began to be able to measure this functionality, the functional connections. And it means that as we are doing a task, some parts of brain are active simultaneously. They can be distant from each other anatomically. And for example, an attention test, a STROOP, is made and fMRI is applied, performed on the kid. We see the anterior singular cortex and occipital cortex because he's reading, and thalamus because filtering different data are shining at the same time, and we call this system is the center that is responsible from selective attention, and this is how we do it with functional connectivity. We can measure it with fMRI or EEG with the analysis techniques, of course. We will give some details about it in the afternoon presentation tomorrow, but with EEG, with graph theory studies, we see that we can define the neurobiological impacts of anything. The occipital cortex, parietal cortex, and the others they all create a network among themselves, and if you are having a research about craving, you have to choose one of these networks and you have to determine a paradigm for that. Effective connectivity means that there are the brain parts that are activated consecutively. For example, while doing a task, the first frontal cortex, then other cortexes are activated one after another because one impacts the other, and there is an effective connectivity between them. So the results and the relation of these to our research about technology addiction. So 74 technology addicts and 40 recreational users. They are separated by this Chinese internet addiction scale. If a person play games more than 50 or 60 hours a week, then he is considered as an addict. And as this research was made in our location, we also did a research about the most popular games among children, which are Clash Royale and Angry Birds. Well, it's not really popular anymore though, but in the past it was. And in a game addiction study with kids, Clash Royale game is very important. You should ask about specific games. The addiction group should play Clash Royale for more than some specific hours, and the control group should consist of kids who play the game less than specified game. This study in China and Korea is about LOL, League of Legends, and the result shows us that for the recreational gamers and addicted gamers are the putamen gyrus anterior cortexes, anterior singular cortexes have 60 connectivities, which means that the persons catch the tips if they are addicted, quite faster. For example, the kids, the addicted ones, whenever they hear a game related to, whenever they hear a word related to the game, they immediately start thinking about game because there's an increased connectivity in insula. Another study, again with 74 addicts and 41 recreational users. The BDT is applied to them, and after a month another fMRI imaging was performed, and 16 of them was left unsullied, and BDT was performed by them. BDT means the interventions about craving. They had some treatments, some sessions about managing their addiction, about reviewing their gaming habits and so on. And still in striatum, and especially in parietal lobe and frontal gyrus, has 60 connectivities again, which are about self-evaluation. So neurobiologically, when we take a look at our brain from the frontal, from this side towards from the sides inwards, the medial frontal gyrus, medial parietal gyrus or promotor sulcus are the areas of brain about self-evaluation, and six, the connectivity between them are correlated with symptom severity. And it shows us that after the BDT sessions, the striatum and parietal lobe, left inferior parietal lobe, the connectivity between them starts to decrease. And this decrease has been placed as a moderator factor. Another study shows us that in the frontostriatal nucleus accumbens connectivity, 43 game addicts and 40 recreational gamers, STUTO is applied and fMRI imaging was performed, and in the cortex there is a volume increase which is expected normally. In the Stroop test, correction rate has been found to have a positive correlation with that, and there is another positive correlation between addiction and violence. It is a datum that shows us that addiction distorts our normal brain function. And between prefrontal towards the other parts and inhibitor acts as an imprinter, and due to the long-term results of our addiction, prefrontal inhibition is reduced, and therefore we do not attribute connectivity towards the results of our actions. In the recreational game users are also reviewed in this study. This is a follow-up study. CPT is performed on them. 1 year in the addiction group, anterior singular cortex volume decreased. This is also expected, and attention focus is deteriorated. About connectivity here, the reduction in the frontal cortex, the striatum to putamer, there is a reduction. So inhibition power of this cortex is reduced. So addiction is the process dominated by striatum. It's the limbic imprisonment. The limbic system is dominated, and prefrontal becomes dysfunctional. It's like that in all the addictions and in digital addiction as well. So competitive control skills are removed, and the person becomes more focused and oriented to momental joys, temporary joys. Occipital gyrus and putamen has increased connectivity. When you enter this article, the occipital gyrus, of course, about the visual and spatial skills, this increased sensitivity with the connectivity to insula makes these people more sensitive to tips. And occipital cortex is constantly working in game addicts to increase their game skills. So this is another study, and the reason that I'm talking about it is that if we are to do research about that, we have to design the research like that. The League of Legends are used in this study as well, and they have a score of, the addicts have a score of 50 in the game addiction scale, and the recreational users have 30 points in the Chinese game addiction scale. And this study focuses on the differences between them. The social isolation is an important cause and effect of technology addiction, and the data about social isolation in increase by the internet or digital addiction. What's interesting here is that if the connectivity is more, then the loneliness, violence is much more reduced for the people. But for the frontal cortex loses power, the loneliness becomes more of a problem. You have 5 minutes. The last connectivity study, it's about default network. I would like to introduce all of you to this. The new connectivity studies are CPM. CPM means connectome-based vector model analysis. The new fMRI studies or EEG studies, the brain is imaged in a horizontal way, and the cortical parts and the relationship among them are evaluated. They are based on AI. You put forward a model, and in this model here is the CPM model, and by 80%, with 80% success rate, it can tell whether the kid is game addict or not. It's important because if we continue with them, we will be able to use them in a couple of years in our clinic studies, in our clinical practices as well. The lack of award syndrome is important as well because some people are hypodomargic. They have a lower dopamines by nature, and therefore they are more prone to the effects of addictive materials. I always say I call them the euphoric people with majestic. Hypodopaminergic people are common. They are not rare. But it is a risk factor for a lot of psychopathology and for addiction as well, because your mind is very sensitive to addictive materials. Self-medication is an important difference between the addicts and the recreational users. The social phobia, for example, people who have social phobia drink alcohol to overcome it, or when you have a bad day in school, you see a TV show in Netflix or a game. This is your strategy for escaping your problems and to self-medicate yourself. We see it a lot. We observe it a lot in some kids who are always in need of phasic dopamine, and they have attention problems, but they play a game for 6 hours because they enjoy the dopamine levels that are excreted. You know the marshmallow test. Waiting of patience with rewards for the rewards, but some kids can never learn the long-term awards, and they prefer if you have to make a distinction between two types of awards, one a smaller one, but you don't have to wait much. The other one is a bigger prize, a bigger award, but you have to wait longer for it. So some kids always go for the lesser award or lesser prize because they don't want to wait. If the person considers like that, their risk of addiction is much higher, and social isolation, like in all psychopathologies, is both the cause and the effect. And for escaping the painful emotions, some people use the digital world as a functional strategy.
Sometimes I showed these rats to parents. These rats were left alone in their playgrounds, and if you leave them alone without any slides or any balls or anything like that, or treadmills around, they go and drink the sugary water placed there. But when they have anything to play with, they actually play with their friends or play with games or any other play things in their area. but they don't drink the sugary water, they only drink water. So this is actually the background of this rat study. This is the strategy to combat internet addiction. This problematic gaming addiction or internet addiction could be seen as a whole area. As a clinician, this four-class classification, we need to look into that, and we need to look into the suggestions that come along with that. And that's all for my presentation. Thank you very much.